Hey there. I have a friend who is having knee pain,
Okay.
and she said that her chiropractor told her. I'm looking up what she wrote to me. I just want to make sure I get it right. She has tendonitis in her knee. She said there's no joint problem. The joint is stable, and
Okay.
that there's popping sounds in the meniscus, and it's painful when she tries to sit on her heels, and she said that she got it from doing too many squats at the gym.
Okay.
So
Yeah. So I'm gonna guess that the knee pain is on the side of her knee.
yes.
Yeah. Okay. So the issue is even though she's having knee pain, it's actually I'll agree with the chiropractor and say not that that matters, but it is a type of tendonitis, but that it's not the tendon that is like in and around the knee, like as the joint, but it's actually the big tendon that runs along the side of the leg, like from like kind of like your hip, and then it runs all the way down the side of the leg, and then eventually comes down into the knee area, and then kind of starts to contribute to like the kneecap. So it sounds like she's having a little bit of a tracking issue with the kneecap, which is tied to this muscle being, or this tendon being tight, which actually happens in women more than men, because of the structural anatomy. It's a little bit, women are a little bit more predisposed to this injury.
Mhm.
And the key is to unwind this IT band. It's short for iliotibial band.
Yeah.
But it's basically a big tendon. It's the biggest tendon in the body. It runs just down the side of your leg. But the problem is you'll feel it in the knee, but the issue is up higher, right?
Uh-huh.
And when it's bad, it's like even if you put your hand on the side of the knee and then have them move it, like it feels like something's like clicking or popping. And it's the way that the tendon and sheath are moving in the joint. And what happens is, like, if this is the kneecap and it's supposed to be this way, with iliotibial band syndrome, it actually starts to rotate like this. And so it's almost like, instead of going like this, it's like this. It starts to actually rotate the kneecap. And so the goal is to relax the quadricep, which is the front part of the thigh, but more on the outside, and then treat that outer tendon. So again, marjoram would work, pepper in the pepper supreme, like that version, viscosity, all of that would be really, really super good. Part of what you're doing with the peppers and the pepper supreme and the viscosity is you're increasing circulation, you're reducing spasm, and you're thinning the viscosity of the lymph in the area. So it allows for more fluid movement in the area, which allows for the fascia to release. And so I would put that on neat, like just down from like her hip, just several drops along the side of her leg, and then all the way down to the side of the knee, and at least once a day, but even twice a day if possible, like morning and night. And keep in mind that it is a tendon issue, and so sometimes tendon issues can take a little bit to unwind. But that should get it. If it's usually with like an athlete, like if they were a runner, a tennis player, a basketball player, a cyclist, triathlete, something like that, where they're doing a lot of repetitive motion with something like that. It can happen with people who are meditating down in the lotus posture or sitting in Indian style, however, that can also aggravate it quite substantially. I usually will step up. I still do the same treatment, but I give them some Shazandra internally, which helps to hydrate the fascia and help increase the the release of the tissue from the inside out. You know, it's not great for like acute treatment, but when you're dealing with a chronic issue, and I would say this problem before it was causing her pain was there for probably quite a while. Like it's something that just doesn't pop up like quickly. You know what I mean? So the issue is the women's hips are a little bit wider for childbearing, and so the legs come in at like a sharper angle, and because of that the IT band can get stretched more due to that. And so women tend to develop the tibial band syndrome more so than men. And then if there's history of like wearing high heels and things like that, that will also contribute to the issue. But if you go through and you treat the IT band over a period of time, it usually unwinds and goes away unless there was a lot of repetitive motion, like say with running, cycling, tennis, where you're running real hard and then stopping. You know, that can be real hard. Or like you said, like a lot of squatting. Sometimes in martial arts, they'll have this issue when they're having to do that standing posture that's like a semi squat. And so, you know, like if, like with athletes, a lot of times I treat them through, they're still getting treatment for it and they're still usually training. You know, so it takes a little bit longer that way, but they stay kind of functional. It's probably best if they can let it rest for a little bit while you're doing the treatment. But if they don't want to, it still will work. It just takes a little longer. Like that's the trade-off. And so, yeah, that's what I would do. And I would say if she wears high heels a lot, probably just refrain from high heels for a little while. But she can go back to high heels later. What's that?
She's not a high heel wearer.
Okay, perfect.
Yeah. So as far as the 3 that you gave me, so she should do Marjoram, Pepper Supreme, Viscosity, and all do those neat, like one at a time.
I would probably just like Marjoram would probably help, but I would probably do either the pepper or the Viscosity.
Okay.
Yeah.
Great. Wow. Well, thank you very much.
You're so welcome. That is the quickest way without having to do like manipulation on the leg. That is the quickest way that I know of how to go through and treat it. Sometimes, like in really extreme cases, I'm going back to like runners and cyclists. If it's just not responding, what I would do is do like a, what do you call that? A poultice, like when they heat it and like a poultice, like where you heat the herb up and then you put it on the body and then put something warm on top of it. Is that what that's called, a poultice? And do it like mid-thigh, but on the side. So you have them lay on their side and then pile up, and you use the herb lobelia.
Okay.
And you do that, and like a single treatment or 2 will knock it out. I usually still treat it with the pepper and the Viscosity for a while, but in extreme cases where it was somebody like athletic and they were needing to perform, you know, we need to pull out the big guns. I mean, that poultice is going to cost probably 20 or 30 bucks of just herb to do it proper. And so, you know, if they're in pain, it makes it worth it. But usually we try to handle it other ways first. But I can talk you through that if we need to go that route. But usually the pepper will knock it out. But in extreme cases, there's still things that can be done.
Great. Thank you.
You're so welcome.
Again, thank you.
And then go ahead, Robin, then Ralph.